Thanks, everyone. I thought we'd get started. We've got a little more time in the session that we had yesterday in here, but it's all about these guys and you guys and less about me and formalities. So I thought we'd get going. Thank you very much for joining us. My name's Hamilton. I work at Volunteering SA&NT, and I'm delighted to be here to facilitate or to introduce this session. Welcome to the Big Band Room. I love being in the Big Band Room. It's kind of cool. Thanks to ANU, obviously, for opening up the campus and having this session. Thanks also to the Federal Department, of Aged, I should get this right, the Federal Department of Health and Aged Care, for also sponsoring this session as well. I too, like all the rest of us, would like to acknowledge that we meet on Ngunnawal land and we acknowledge emerging leaders past. We acknowledge the traditional owners of I think the best way I've had it described to me one time was that the longest continuing culture on this planet, which is pretty amazing. So just acknowledging that. Welcome to everyone online as well who are joining, and we are also obviously recording this session so we can review it later and we can share with colleagues and friends as well. So Kirsten Turner is our first speaker. Kirsten is the Director of the Consumer Support Section of the Department of Health and Aged Care. Please welcome Kirsten to the stage.
Thank you. Thank you, Hamilton, and thank you for providing that beautiful acknowledgement to country as well for the land we're meeting on, Ngunnawal land. So as Hamilton said, my name's Kirsten Turner. I'm the Director of the Aged Care Consumer Support Section in the Department of Health and Aged Care. So in the area, we have responsibility for aged care volunteer policy and the Community Visitor Scheme, or CVS, which will soon be renamed the Aged Care Volunteer Visitor Scheme, or ACVIS, which I'll speak to later. So volunteers are an essential part of the aged care system, with a long history of supporting older people to live meaningful lives, build social and community cohesion, and prevent social isolation and loneliness. Volunteers support older people in many different settings and activities, including in residential aged care facilities, home care, within the Commonwealth Home Support Program, or CHSP, and the CVS. Volunteers provide a variety of support within aged care, with some examples on the slide, which you can sort of see, but we'll make the slide available after the session as well. And so those sort of activities include specialised volunteering activities in palliative care and dementia care as well. Aged care volunteers contribute to the person-centred approach of the aged care model, and that's respectful of and responsive to the preferences, needs and values of the older person. However, as you're probably well aware, the participation of volunteers has been declining for well over a decade, with aged care volunteering particularly badly hit since the onset of COVID-19 pandemic. The aged care workforce census in 2020 reported that nearly 12,000 volunteers provided support at residential aged care homes, and this is a 49% reduction since 2016 compared to just over 23,000 residential aged care volunteers which were reported during that period. Similar declines were evident across the aged care sector, as reflected in the slide here. There we go. So now I'll speak to the Community Visitor Scheme in particular. Do we actually have any CVS auspice coordinators in the room? Welcome, thank you for coming. What I would say is these are the experts in the room. I would probably encourage you to speak to them afterwards about their experience in delivering CVS, but it's wonderful to see you all. So the Community Visitor Scheme, or CVS, supports volunteers through a range of community volunteering organisations, or we call them auspices, to form friendships through regular visits with senior Australians. CVS has a unique focus of supporting older people in developing friendships with volunteers from their community, and seeks to match people based on their preferences, interests, language and background. And the PowerPoint has an overview of this process. Sorry if it's a bit murky. Effective matching of consumers with visitors is essential to the success of the CVS, and is something to which auspice coordinators devote significant time. The personalised and relationship-focused nature of the CVS sets it apart from other aged care programs that are focused on delivering practical and task-focused support for older people. Last year, CVS funded 181 auspices with approximately 9,245 volunteers, connecting an estimated 250,700 visits. The visitation numbers, volunteer recruitment and retention continued to be impacted by COVID-19 restrictions over this reporting period. And these volunteer numbers are down from 12,000 volunteers in 2018-19 financial year. But actually the number of activities has returned to sort of normal. So it'll be interesting to see what the trajectory of that is over the next reporting period. The other slide. The slides illustrate other key statistics. You can't really see it, but this graph here down the bottom represents how many special needs groups, which is what we term it in aged care, who are recipients in the program. So we have 52% who are from culturally and linguistically diverse backgrounds, 31% are from remote and rural backgrounds, then 2% are from LGBTIQ+ and First Nations, and then we have the purple one is other. So this graph shows CVS activity by type, with the blue for residential and the green in home care for 2022. So in exceptional circumstances, visits can be provided through telephone calls, writing letters or virtual visits if in-person visits are not possible in the short term. Phone calls are the most common alternative type of delivery. I'll discuss more below, but during the height of the COVID-19, which you can see in this bottom one here for 2020, alternative means of delivery were much more common, with phone calls and letter writing the most common types of alternative delivery. Upon the declaration of the global 19 pandemic in March 2020, CVS auspices immediately experienced impacts to service delivery. In many cases, visits were suspended indefinitely due to the closure of residential aged care homes to visitors. $10 million in additional funding was made available to CVS providers over 2019-20 and 2021. The main categories for the additional money that was spent was on additional staff hours, purchase of technology such as iPads, training across topics including in language for cold groups, flu vaccinations, marketing and promotional material for CVS, and personalised protection equipment and COVID-19 safety packs. There was also additional departmental support for CVS providers and volunteers, including free access to mindfulness support resources and grief and trauma support services. Many CVS auspices also reported their volunteers were provided access to the organisation's employee assistance program through the additional COVID funding. This was in recognition that many of our volunteers are older themselves, experience loneliness, and are not being able to volunteer, took away a large part of their own regular social connection during the pandemic. I'll talk about some common experiences of CVS auspices and volunteers, and this is with the caveat that auspices also had contrasting experiences, especially depending on their location. So there was increased demand for the service from older people, with many auspices reporting an increase in their waiting lists. However, there were concerns from auspices about the ability to meet increased companionship needs of aged care recipients with decreased person resources, including volunteers, CVS provider workforce, and workforce shortages in residential care homes. The administrative and support needs for volunteers also increased markedly, including the provision of updates for COVID-19 through the Department of Health notifications, HPPC guidance, and legislation requirements for their state and territory. There was widespread reporting of loss of volunteers due to withdrawal due to mandatory vaccination requirements for both flu and COVID, fear of infection for their CVS friend, themselves or family members, volunteers struggling with utilising technology, and increased stress due to COVID circumstances, especially for those who are essential workers. Lockdown or restrictions impacted on in-person visits in residential care homes. Auspices reported continued restrictions by homes after state requirements eased. There was also a reported lack of consistency between aged care homes regarding visitation protocols. Many residential aged care homes went into lockdown and did not facilitate CVS relationships, and this was mostly due to limited staff to assist with technology. Many CVS providers reported that particularly those who are hard of hearing or experiencing dementia had difficulty with phone or digital communication or communication with a mask or PPE, with care recipients withdrawing from the service due to this. In addition to the risk of losing vulnerable older people in the service, consistent feedback from auspices, network members and older people is that the delivery model of face-to-face visits are preferred as a means of building meaningful human connection and friendship. However, despite the difficulties during COVID-19, there are also many positive stories and solutions within the CVS program. CVS auspices and volunteers showed incredible resilience and innovation in how they supported their CVS friend, with CVS providers and volunteers going to great lengths to retain contact and support for their CVS friend. Auspices arranged veranda and window visits, virtual picnics via FaceTime. Volunteers dropped off home-cooked meals and cakes and grocery supplies. One volunteer made digital contact and presented live cooking, sewing and gardening segments for their care recipient. And cold recipients received thinking of you cards in the mail in their own language. There's also an increased awareness of the impact of social isolation in the community. Some auspices reported an increase in volunteer interest due to the restricted access to loved ones, general public awareness of social isolation faced by older people in residential care, and increased understanding of the impacts of isolation due to their own COVID experience. The value and importance of volunteers was further recognised. The industry code of visiting in aged care homes was identified the need for risk-managed visitation and that volunteers could be designated as essential visitors to enable access to their CVS friend. And this greatly assisted with aged care homes to enable access to see people. There are instances of CVS volunteers playing an intrinsic role in the lives of their CVS friends at this time, such as the quote on the screen, which I'm not going to read out because I think I'll cry, but it's very nice. So another program that we also had during this time was the Re-engaging Volunteers into Residential Facilities program. With the decline of volunteers in aged care, it was exacerbated due to the Omicron variant of the COVID-19 pandemic in December 21 and January 2022. The environment in residential aged care homes became challenging, with many facilities struggling to maintain sufficient staffing levels, resulting in a loss of support for clients, with the re-recruitment of volunteers down the priority list. The intention for the program was to boost volunteering in aged care homes, with volunteer roles focused mainly on providing social companionship support, along with exercise, mobility support and admin activities. The Volunteering Australia Peak bodies, such as Hamilton here, in each state and territory were engaged to onboard volunteers and match with interested RACFs. The program had many of the same thematic issues as CVS during COVID. Overall takeaways included that many volunteers reported they gained or developed new skills, knowledge or experience in interacting with older people, particularly for students studying in the medical and health fields. There was initially some reticence from aged care homes to re-engage volunteers due to the ongoing impacts of COVID-19, and some key staff, particularly volunteer coordinators at aged care homes, were not available due to illness, leave or resignation to facilitate the onboarding process, which caused delays with matching. A personalised approach, such as following up with aged care homes, calling volunteers to remind them to finish their training, etc., was beneficial in maintaining interest, motivation and momentum. A nuanced local communication and engagement approach had more success than a national broad brush approach, such as local outreach and engagement activities. A consistent approach regarding volunteers across all aged care homes was found to be needed, with some aged care homes requiring additional screening, working with vulnerable person checks or training. The training component was found to be too long at 3 to 5 hours, needed adaptation into plain English, simplified content to support low literacy levels and accessibility, and the provision of downloadable materials in language. So where to from here? So the next steps are for the expanded CVS model into the Aged Care Volunteer Visitor Scheme, which will commence from the 1st of July 2023. So the new ACVIS model will expand volunteer places by 25% and increase funding per volunteer place to be more commensurate with effort. But the model includes activities which seeks to embed the ACVIS as a best practice and sustainable scheme, including increased communication and awareness of the program in the community amongst approved service providers, navigators and stakeholders, the establishment of a community of practicing coordinators with a focus on sharing knowledge, cultivating best practice and fostering innovation. We have some incredible skills within the CVS program, with some of the auspices delivering the service for 30 years, so we want to make sure that those skills are shared amongst the whole cohort. We're going to establish a diversity, complex vulnerability and cultural advisors to inform communication, training, community of practice and systemic issues impacting ACVIS, especially for underrepresented diverse groups that I spoke to earlier. Okay, 1 minute, I'm nearly there. The provision of foundational training to establish minimum requirements for ACVIS volunteer training, improve data collection so we can have a focus on building knowledge about ACVIS volunteers and recipients, and more detailed data for service coverage and policy refinements. And we're also going to be conducting an impact evaluation over the life of the program. So the COVID-19 pandemic has highlighted both the significant role of volunteers in supporting our elders receiving aged care services and challenges for supporting, recruiting and retaining volunteers. There's a challenge of increasing the awareness of the roles of volunteers in aged care from the perspective of individual motivation, community contribution, support and celebration of volunteers. There's also an opportunity for the consideration of how to embed the evolving nature of aged care volunteering in the broader aged care strategic frame as the sector continues the reform journey. The National Aged Care Strategy, which, as you're aware, was launched yesterday, provides a foundation to examine volunteering across aged care in a strategic way and what aged care volunteering should look like into the future. So we want to have you to have your say as well. So we're seeking to consult with the sector about aged care volunteering. What are your views about the future of aged care volunteering? What are aged care volunteer needs, including for training? And what are the views of volunteer coordinators? So you can sign up to be part of this consultation at the booth that we have over in the hall. Otherwise, there's some contact information at the bottom here. Thank you.
Thanks so much. Thanks, Kirsten. That's great. Just put that there. Our next presenter is Dr. Megan Paull. I'll say your unofficial title, which is long-time researcher on Murdoch University out west. So please welcome Dr. Megan Paull.
I'm aware that I speak very fast, so if I get too fast, tell me to slow down. I can always skip some slides, okay? So I did some research with Dr. Sally Paull, who is a long-time colleague in the area, which was paid for by a Lottery West grant. We're lucky enough to have these sorts of grants in Western Australia, but that means our research was limited to Western Australia because that's their remit. However, we looked at volunteering in aged care settings during COVID, and the idea was to be able to look at what COVID brought that might stay. That's not quite what happened, and I'll explain a little bit more to you as we go. The research was undertaken in Western Australia, primarily in Perth. The people that participated from outside Perth were in their own country, but I would like to acknowledge that Murdoch is situated on Whadjuk Noongar land, and we did not get great participation from First Nations people in this research, which is regrettable, but we're talking to Jacquier, which is has a council of elders, which is part of Murdoch University, about how we might take that a little bit further in the future. The report that we produced is actually available on the Volunteering WA website and can be printed out, and includes a whole series of good practice guides. So I'm only going to touch on a few things in relation to this research, because otherwise I would be here for hours, and I teach 4-hour classes, so I can talk that long if you need me to. So in the background of all of this was, of course, all the things like the Royal Commission. There was actually the Disability Royal Commission happening as well, the emergence of the quality standards. There was changing government policy, which actually kept coming. I signed up to all the emails that were coming in from all the policy changes. It was quite overwhelming. I still get them. They're not quite so frequent anymore. There was also a COVID-19 impact that was visible in other states that informed things that happened in Western Australia, even though the impact in WA was not as great. And there was a constant updating of health advice at the state government level as well. And we had a rapid increase in academic literature. A lot of the academic literature went straight out to be available online with limited peer review. And in fact, some of the things are now being pulled back. So that was an interesting time for those of us in academia, where things can take 2 or 3 years to make their way out. We had also undertaken a previous project, which was called the Jacquier project, where we had started looking at volunteering in aged care, which was what had been hijacked by COVID. There was also the recommendations from the Royal Commission were very limited in relation to volunteering, and I think the government response was even more limited. I don't want to spend a lot of time on that, but that was a context that was happening in the background as well. What is happening? What I can see here and what I can see there don't look like they're the same. Sorry? Yes, no, the background stamp is deliberate. Now we seem to be right now. Yeah, okay. So in terms of the statistics about volunteering in aged care, we decided we'd go and find out what it was, and we discovered that, in fact, the statistical methodology had changed from 2016 to 2020, so that meant it was really hard to compare, and there were only some things that were taken into account, and all that was being relied on was what organisations had reported, and there are lots of volunteer activities that happen in aged care settings that are not connected to the organisations that were reporting, and so on and so on. So what we found was there was no way of finding out what the volunteering was like in aged care settings, and one of the reasons that this became even more apparent is that quite a lot of volunteers volunteer in more than one aged care setting. So then if you start counting people, you're starting to get different numbers to if you're counting volunteer hours and so on. So that made it quite difficult for us to get any sort of background as to how many volunteers there were. Yes, so what's happening is I'm getting each slide twice for some reason. We adopted the Volunteering Australia definition for volunteering, despite the fact that there are lots and lots of definitions out there, but we figured we were partnering with Volunteering WA, we should take on their definition. And we also, when we was talking about aged care settings, we ended up largely confining it to residential aged care facilities and CVS volunteers, despite the fact that there were lots and lots of other types of volunteering taking place. The research approach that we took was a staged approach, and yes, so it was very much an iterative workshop-based process. We talked to volunteers and we talked to volunteer managers and organisational representatives. We originally planned to do a lot of that face-to-face. We ended up doing quite a lot of it online, and some of the face-to-face was interrupted by COVID, but there was also one that was interrupted by a major storm that took out the Volunteer Resource Centre out in the Midland area. That meant that the library moved into the building that we would have been using, and all sorts of things happened. So we just had to keep going, and of course all the volunteers were willing to keep going, and the volunteer managers were willing to keep going because we'd got quite used to that by then. We also looked at all the literature, as much as we could possibly find. Actually, there's a lot out there, but a lot of the literature doesn't talk to each other. We had lots and lots of brainstorming and interactions with the reference group that we formed. The reference group consisted of people who had long-term experience in this area, and they were great in terms of when we put something together and gave it to them to have a look at, they come back and say, what do you mean by this? Or if you say that, this is the way it will be interpreted. There was a whole range of things that we did that led to the development of these good practice guides. The draft good practice guides were then taken to workshops and we sent out a survey. Some of the survey responses that we got were pretty much thumbs up, but quite a lot of the ones that we got said, you need to add this, you need to add that, this information. What we began to find was that they were getting very detailed. So the difficulty, of course, was thinking about all the different settings. You can see where people said they volunteered was really wide and really varied. And some organisations had some volunteers doing all of this, or not all of it, but pretty much all of this in a single volunteer connection, whereas others were doing lots of different things. The peripatetic musicians, for example, who were going from place to place, went into lots and lots of residential aged care facilities, but they also went to senior citizen centres and so on as well. The guides that we developed, we started out thinking we would have a guide for volunteers and a guide for volunteer managers. A bit naive, really, I suppose. We ended up with, unsurprisingly, policymakers and peaks and senior managers and boards. And this is interesting because there was a question earlier, I think, about how do we get the people at the top of our organisations to pay attention to volunteers, not just the volunteer managers. This was something that we came across that was a repeated problem. Because of the data, we also came up with guides for staff working alongside volunteers. And this was an area where there was quite a bit of tension. And it appears that some staff fear that volunteers will take their jobs, that sort of thing. But there are also reverse concerns about, well, volunteers think we should be able to do this for the clients and so on. There was also a lot of evidence that there were frontline managers of volunteers who were not the person responsible for the volunteers. So the receptionist at the facility or the OT in the area leading the activities. And we felt that there were some things that they needed to know that were kind of an extract from what the bigger picture looked like. When we put it out in its almost final version, it became really clear that we needed actually to delineate between current volunteers, guide for volunteers, and a guide for potential volunteers. Because there were things that potential volunteers might need to know and might need to think about that was a subsection of what they needed to know once they actually had made the decision to volunteer. That too much information before they start might actually not lead to them starting. So one of the questions that we asked was, is volunteering in aged care different? And of course, we didn't come up with an answer of yes or no. We came up with yes and no. Different contexts brings different rules and different frameworks, but actually that's across within aged care settings as well as aged care and other settings. Communication, however, came out as being at the base of everything. Are you surprised? It's one of those things that actually everything circles back to communication, right? So the communications during COVID-19 were organisations needing to be quickly on message, but what sometimes happened was they forgot to include the volunteers in the message. So sometimes volunteers didn't know what was going on in their organisations. They didn't know whether they were included or not. If the COVID-19 communications that were designed to keep staff and families and so on informed had a section that said staff and volunteers, or something that separated out volunteers, volunteers would also have felt more valued. But this was only evident in a very small number of places. Volunteer managers actually had to spend a lot of time finding ways to help keep their volunteers in touch. And in some places, what happened was they lost hours. In fact, one of the volunteer managers had their hours reduced significantly because there was no volunteers. Why do we need a volunteer manager? A little bit short-sighted, but it was evidence of the way some of the thinking was happening. So the organisational support of volunteer programs actually needed to be really focused on the volunteer programs. Some organisations were not as well prepared as others. And some were really prepared for staff and clients, but not volunteers. In some organisations, there wasn't enough PPE and masks and so on to include volunteers. So in terms of the stocking up, they hadn't thought about volunteers. Volunteer programs were put on hold beyond lockdown, and in some cases because the parent organisation in other states was still on lockdown, which of course, Western Australia, we were lucky enough not to have too much a lockdown, but when your parent organisation is in Victoria, your organisation says everybody's following the same rules, that's a problem. Volunteers were not allowed on most sites during lockdown, and some volunteer managers were moved to other roles, moved away from what they were doing. So this meant that the volunteers felt that their program wasn't highly valued. And I'm sure that's not the case. It was just in terms of the priorities, it didn't feel like it was the case. Volunteer management, actually what happened was the volunteer managers stepped up. They worked from home, they relied on technology. We had one volunteer manager who was on very small hours, paid hours, contacting volunteers individually at 10 o'clock at night to make sure that they felt connected to the organisation. We had paperwork that became more efficient. One organisation reported getting 6 forms down to 2 sides of 1 page. Volunteers loved that, so did the volunteer managers, but because there was time to do that. Initially, recruitment interviews went online, and in a lot of organisations that saved a lot of time, but there was a swing back to the final interview before you start, moving back to face once things went back to normal. The recruitment of new volunteers during the pandemic was also associated with new activities, things like writing letters and all of that sort of thing. And there was a lot of new online training that became mandatory, and some of those new modules have stayed in place, but there's also been evidence of the swing back a little bit with some of that. There was a loss of existing volunteers, and quite a lot of the older volunteers actually didn't come back. There was COVID hesitancy, age limits, health concerns, all of those sorts of things got in the way. Some of the new volunteers stayed, but others fell away. They went back to the lives that they had previously. They became busy again. The time invested in recruitment and training has actually paid off for some organisations, but there actually needs to be more clarity and greater shared understanding of the requirements for volunteering activities on site and how that supervision operates. Some volunteer managers who went above and beyond to communicate with their volunteers in their own time weren't always recognised by their executive, which is really sad. Volunteers reported missing their regular activity. Volunteering contributes to the volunteers' health and wellbeing as well as to the clients, and volunteers missed being in contact with clients. And I'm just going to diverge here a little bit from my slide. One of the organisations actually found that one of the volunteers found that their organisation had a policy of not informing volunteers when a client had passed away. And that was a really difficult, that's not something that we've found is uncommon, in fact. And so what that means is that the volunteer doesn't get the opportunity to go to the funeral or any of those sorts of things. My understanding is that sometimes that can be, it's that the family has made that choice, but actually that sometimes the volunteer doesn't find out until much, much later. And of course, during the COVID lockdown, the gaps between visits were bigger as well. The essential volunteer policy changed towards the end of our research, and the understanding of being able to nominate a volunteer as the essential visitor was an important addition to how things could operate. The staff and volunteer relationships I've already touched on, but what we found was that staff didn't have time to help with technology for some of the activities and so on that were trying to be done remotely and by volunteers, so that didn't help. And of course, they resented being asked to fit these things in at times, particularly if they were felt busy and under pressure. But the other side of it is that volunteers sometimes find themselves in the situation where they're not allowed to do things that they think would help. Actually, on the sly, some of the volunteers told us that they did stuff anyway. They do stuff anyway. You know, the quick drop at the shop on the way home and stuff like that. The organisations don't want to know about that, but it's a reality. The level of trust between staff and volunteers was eased by good communication. Now, after we put out our report, we did have a small section about diversity and inclusion, dignity and respect. We found that the people who participated in our research were perhaps not as diverse as we would have liked in terms of who we were able to reach. We did try and seek as much feedback as we could. We had someone contact us via LinkedIn to say we could have paid more attention to this, but we were using the data that we had been given. And this is an area that we're looking to grow our research in. But we did also find that there was a need for ethno-specific volunteering, for volunteers to work with particular groups, and particularly in the area where perhaps people had reverted to their language that they had from birth, and who needed to work with or spend time with or have companionship from volunteers who came from their background or who at least understood it. The COVID-19 isolation actually exacerbated all of the contact that these people could or could not have. Yep. So that's it. That was good timing. How to find our report. It's on the Volunteering WA website. I could talk about this for hours. We're still writing papers out of it, but I just wanted to say thank you.
Thanks, Megan, so much. One of the things we've said in our office is that, and I don't mean to oversimplify it, but the kind of what this sector has experienced over the last 10 years was kind of highlighted or exacerbated by COVID. So COVID in a way shone a light on something that was there and has allowed us to talk perhaps more about it than we wouldn't have. I'm a glass half full kind of guy, so. I'd now like to welcome David Jacquier up to facilitate the session, not because I wanted to contract it out and I didn't want to do it, but because David in our team is, David, and he will explain what he does, really knows this sector inside out. And I thought who better to help facilitate the questions, get the most out of you guys, and also support Kirsten and Megan in answering the questions. It's a wonderful opportunity with David here. So please welcome David Jacquier. He'll facilitate the questions. We do have about 35 minutes, which is great. Thanks.
I would also like to acknowledge the traditional custodians of the lands on which we meet today, the Ngunnawal people, and pay my respects to elders past, present and emerging. I'm sure you have lots of burning questions for Kirsten and Megan, so I'll keep my introduction about myself very brief. I am the coordinator of Volunteering SA&NT's Commonwealth Home Support Program, Sector Support and Development. We support providers of in-home aged care in South Australia in all aspects of their volunteer involvement, from recruitment, onboarding and training, through to volunteer recognition and continuous improvement. With the current reforms in aged care, we also are discussing topics and issues such as SIRS, unit costing for volunteer involvement, and other aged care reforms. This year, CHSP sector support and development providers have been invited to participate in an electronic community of practice platform. And the idea being that we can share resources and conversation about the reforms in the Commonwealth Home Support Program, and in my case, how that relates to volunteering. The community of practice is also a line of communication with the Department of Health and Aged Care, and Volunteering SA&NT will act as a conduit between the department and the volunteering sector with respect to CHSP. So now is the time to begin and to continue conversations about volunteering in aged care into the future with all stakeholders, including, of course, volunteers and clients themselves. So I'd like to open the floor to questions. Thank you, Cindy.
Hi, my name is Ricky Spencer. I'm a community sociologist and I work in the diversity intersectional spaces. One project that we're looking at in Victoria at the moment is advanced care planning, and especially for those like myself who are LGBTIQ, like myself who's also stolen generation disability. And I'm just wondering, in terms of the research, and I was quite interested in hearing about diversity in that space. With the government's initiative for advanced care planning, we noticed that there is very little, I guess, information for my community And one thing I'd like to raise to everybody here to understand is that there are a lot of older people who don't necessarily come out to their families and live by whatever means, through shame or fear or stigma. And the importance of accepting love, however love may present itself. And I'm sorry, I'm a bit passionate about this because it's like a living experience for me. I just want to know, with your experiences and going forward, how can we work more effectively with our communities? So especially my interest in advanced care planning, because that, I believe, is a way forward where we can all plan at any age how we wish to be named, for those of us who are trans, how we wish to be in our faith, for those of us who have pets, to have our pets later on buried with us, but also to bring that care back. Sorry, I'm talking a bit, but I'm just trying to shape the space. So that everybody here is aware of that and the importance of advanced care planning, and in this research moving forward. How can we make aged care more inclusive so that everybody can be safe to be themselves, whether you're 80 or whether you're 105, and be supported in whatever state? Thank you.
Is this on? Yes, it is. The first observation I would make is that I come from a white Anglo-Saxon middle-class straight background. And so for me, I need to learn about all of this. And so whenever I try to go out and do research in whatever area, I don't know how to make the approach to invite the people who need my help to do the research to lead the research. The walking beside type of research is the sort of research that's needed. And I think it's the case that the walking beside approach to however policy is developed and all of those sorts of things is needed as well. I think the biggest thing is that there is now an urgency. And so I'm happy to have a conversation with you afterwards about that.
Yeah, I don't know if I have as much to add, except that working in this space, we do see the importance of our LGBTIQ plus organisations who spend so much time, especially in the CVS space, making sure that it's a safe space, making sure that the volunteers they bring in are properly trained, are probably from an LGBTQI plus background as well, so that they can see themselves reflected in their supports as well. I don't know if I have as much to add about advanced care planning, but it's one of those issues, as Hamilton spoke of, that is an intrinsic issue, and it came to the fore with COVID as well, especially with how people's directives around medication and their wishes around management with the COVID occurred. So I can't really comment on the advanced care planning aspect itself, but I think it's a very interesting point that you raise.
Thank you. Kirsten, down the back.
Should we repeat that on the microphone as well? That for the people that, so the gentleman here mentioned that you can do advanced care planning on My Health, and that there's a link there, and that you can, I guess, do it directly, sensitively, of your own volition. Yeah, that's wonderful. Thank you for raising that.
Hi, sorry, just on that to Ricky, we actually work at Advanced Care Planning Australia, so that is something that we are looking to work towards. So there is a service available nationwide. It is a free service. So we have a website, Advanced Care Planning Australia. Please look at our website. We have a 1300 number that you can call. Anybody can call us and ask us about the process, because it is different in each state as well. So more than happy to have a chat with Ricky about how we can help through that process, but just for everyone to know, there is something available to try and help everyone with that aspect of it all.
Thanks, Kirsten and Megan. That was a really great set of presentations. I just wanted to know, and I don't know if you'll be able to answer this, is do you have any information on the demographic characteristics of people that volunteer in aged care facilities? And has there been any change over COVID in terms of the types of people that are volunteering?
I think one of the biggest problems that we had was that we don't have that information very well or at all. Although one of the things that we noticed just in the people that contacted us and in some of the reporting that we did look at is that a lot of the people that volunteer in aged care settings are older themselves. We did look into some of the stuff about why people volunteered, and we did that in the Jacquier project as well, the previous one. And people chose to volunteer because they had older relatives somewhere else that they couldn't connect with, so they went somewhere local. They noticed somewhere local that they felt, oh, that's something in my neighbourhood. They were the two sort of things that stood out to me. People don't necessarily choose to go into a particular type of volunteering in aged care settings, but volunteer transport is another area where people, I love to drive, so that's one of the things that they choose to do. So I think it's one of the things we don't have the information, but it is. A lot of the facilities are talking about the age of their volunteers as well as the age of their clients. And so it is something that we need to work out ways to attract the next generations so that when we're in aged care facilities, we might have people to come and sit and watch TV with us for hours if we need them to.
Just to add to that, I just agree with Megan. Unfortunately, we don't have much data. For the CVS program, we don't have data on our volunteers. Anecdotally, I'd agree that they're mostly older. But under the ACFIS program, we will be collecting that data. So we'll be getting a much better idea of who our volunteers are, also our recipients, so that we'll be able to really refine our policy and also our messaging to make sure that we're doing awareness raising and recruitment in a more targeted way.
Question there.
Yeah.
Thanks.
Yes. Well done. Hi, I'm Kate from Delta Therapy Dogs. Look, we visit 20,000 people a week nationally, and I guess the biggest thing that we've found, probably about 3/4 of our visitation is in aged care, and it's the workforce that's really impacting on retention of volunteers in that side of our organisation. We're in hospitals too, for example, and there's turnover there, but the longevity of those staff there can sustain our volunteers, and their experiences are much better. Whereas in aged care, we kind of, a lifestyle coordinator might last, 6 months. It's a pretty good run for them. And we're finding that really impacts that. And I'm just wondering if there's any strategies or research or anything happening in that space in terms of, I know there's workforce study going on, but whether, how that impacts on the volunteer cohort as well.
I suspect part of the problem with the staff-volunteer relationship is that notion that a lot of that there is staff turnover, but also that the staff that are there don't know what the volunteers are doing and what their contribution is. So, but I don't know what's happening apart from attempting to pay them more perhaps and things like that. But I think the current workforce shortages are actually having quite a huge impact. My parents live in a retirement village, and they're finding that the retirement village is losing the staff to hospitality, who are recruiting at much higher levels. And if, of course, hospitality in the north near our mining centres is taking them even more. So it is an issue, but I'm afraid I don't have answers for you, except perhaps we have to keep reminding our organisations to look after their volunteer managers and their volunteer programs and put them high on the list of priorities.
I think that's a really interesting point that you've raised, and certainly you could understand how that would impact on the volunteer experience and their quality of experience. I don't know of any studies around that either, so I think that's a really interesting question. The Aged Care Workforce Survey will be collecting data around coordinators in the next issue, so hopefully we'll get a better idea of, how many coordinators there are and where they're located. Noting the limitations around that survey, I think you was going to add then. So But I think there's more work that can be done as well of ensuring that coordinators are reflected in workforce planning and that they're a valued part of the workforce. They're not just sort of an add-on, because we know that they have such a significant impact in terms of the quality of life of the older people in the work that they do. So I think there's more work that could be done, certainly.
This is not meant to be about you, but can we move to calling them managers, because they do more than coordinate? I think that's part of raising them up and making them more important.
They're mostly put under lifestyle.
So they're the frontline people that we were talking about that have that role.
So there'll be a lifestyle manager and then a lifestyle coordinator and then a regional lifestyle manager and things like that. So there's definitely a hierarchy within that lifestyle system. But they, particularly for us, we get no government funding, we get no support from anyone. We're doing a lot of this work, and then we're completely reliant on another organisation supporting our volunteers, because we're not in there being able to do that for them. We can do that within our own organisation, but it's such an impact that it has on that longevity. And then we're investing again and again and again, because we're losing volunteers because this whole sector is so transient. So it's a tricky space. I'll keep my eyes out.
There's a question down at the back. Thanks, Sandy.
My name's Elma Limbrick and I work across 2 very small health services in rural Victoria. And I've been in aged care for 27 years, starting out as a lifestyle coordinator. So let me tell you, the issues have been there for 27 years. It's been a constant struggle in the fact that lifestyle has never been it's been a key standard right across, but it's never been funded for that. We worked really hard in the beginning to sort of create diversional therapy and try and make that a standard, and then they changed the ACFI funding and we lost all our funding, and so we lost that cohort of people. I have since gone on to become a volunteer coordinator, and it's very difficult in a small rural community to engage a lot of the volunteers, and COVID we've lost 60% of our volunteers, and some of that, 60% of those are now, probably about 20% of them are now going to be residents in aged care. So the challenge for us in a rural area is how do we do, and we did sign up for the residential aged care funding, and we had no input. Nobody applied because we weren't able to go out and recruit our own volunteers. So that'd be my question, is that I hope with this next lot of funding that small organisations like us are funded to go out and recruit our own volunteers, because we know our communities and a lot of our communities don't go online. The majority of my volunteers are by word of mouth. And I think that's one of the issues that we need to really address, and to look at expanding our volunteer programs so that it's not, we need to change our whole focus on what we want our volunteers to do in aged care. Thank you.
Yeah. So I think there's a lot to unpack there, but I would agree that certainly what we've found is the recruitment of volunteers needs to be at that local level, and that's where we get the successes. But we are trying to have a national approach as well to raise awareness about the need for volunteering and the need for volunteering in aged care specifically. And we know that there's a bit of a stigma around volunteering in aged care now with COVID especially. So we are trying to look at what messaging will bring people into aged care volunteering and try to equip our sort of volunteer managers. I'm talking about the ACFIS program here especially, with tools so that they can be promoting it more effectively as well. And so we do have some nice comms that we've started to do that really reflects the volunteers as a way of engaging them. And you can see that in the exhibition hall. There's a video around ramen and hands, which has had a great impact, with community awareness raising, and also working through we've been partnering with the ABC on the older person's home for teenagers, and that's been really good as well, because once again it breaks down the stigma, shows the needs that are there in terms of social isolation, and what impacts volunteers can make as well.
So I would add to add my voice to yours in terms of the rural and regional aged care volunteering in the Jacquier project. 2 of the regional areas where we talk to people were saying it has to be local, it has to be us, it has to be the people that know each other. One of the most effective things I've seen has been partnering with the other local organisations, and so working out ways to partner with the tennis club or partner with the bowls club to try and work out ways to have the volunteers that are contributing in those areas contribute across, and the members as well. The most interesting ones has been the celebrations of important milestones for the organisations, not for individuals, but for the organisations, which are instead of having something that is about we're going to have everybody wears a hat for the 25th anniversary of the organisation. It's actually, we will have visitors that come from the tennis club and play cards with you during the day. And once people have gone in and felt like they know what it's like inside the organisation, they've felt a little bit more comfortable to have a look and go back. So some of the partnering at local level is some of the stuff that I've seen.
Hi, I'm Leanne. I'm an audiologist on one hat and a CEO of a CHSP. So I tip my hat to the sector support. One of the questions that I had already been answered. So that was how to attract volunteers into a sector that has been a little bit damaged by social media. In terms of, aged care and attracting younger volunteers into the sector. But also one of the other parts was a growing concern for me, and particularly I'm in home care. So is the growing compliance in home care, and that burden is being put on to the volunteers. So how to take that burden away from the volunteers and allow them to be volunteers. Thank you.
Great question. Kirsten, do you want to say? I will. Well, I think a national approach would be a great start, and a framework, perhaps, and Kirsten, you've mentioned that before as well. But we have the opportunity, as I've mentioned before, with the SSD community of practice to talk nationally for the first time. And it's a fantastic opportunity to share resources. But we also want to pass information up from events just like this one to the department and back down to providers, and open those lines of communication. So that's really important.
I would say as well, and I know that you've been very active in providing feedback to the department, and thank you for that. And we've really valued the opportunity to work with Volunteering Australia around advocacy, especially for the aged care reforms and the impact on volunteers, to ensure that volunteers are considered and embedded in the reforms. Certainly the feedback we've been getting from volunteer experience, which once again exemplified through the COVID-19 experience, is that we need to ensure that, the risk is commensurate with the volunteer role, and, the categories that they're looking at right now does have a more risk-based approach in terms of regulation and compliance. So I encourage you to keep providing feedback there. And we're also doing work with the Commission, the Aged Care Quality and Safety Commission, around volunteer communications as well, because I think we need to ensure that when we're communicating about changes and reforms, that volunteers are very aware about how it applies to them. So, you know, the code of conduct, everybody has to be under that code of conduct, including volunteers. And I think there's a bit of fear around how that will be applied. But we just need to be raising awareness that when we're talking about regulation, it's not something they have to be fearful of. It's about respect for the older person, ensuring the rights of the older person. And really that has to come to the forefront when we're looking at the provision of services and support and workers and volunteers into aged care.
So my observation in relation to that relates directly back to the volunteers who don't follow the rules and who think that they're doing the right thing by the client. And I think it's that creating the safe space for the client or their friend and for the volunteer. And as long as the boundaries that are set, the reasons for the boundaries are known by the volunteers, they're more likely to adhere to them. But we're always going to have those volunteers who push the boundaries a little bit. And it is the case that we need to make sure that they're really clear what that looks like, and still make it safe for them when they do. Because what happens is if they push the boundaries and something happens to them, if the organisation abandons them, we've lost them as a volunteer.
I'm really patient. My name's Fiona. I work with palliative care volunteers in remote and regional New South Wales. It's a huge area of past Goulburn down to the border of Victoria, coast up into the snowy mountains. So traditionally in New South Wales, palliative care volunteers have never entered residential aged care. And considering that residential aged care is one of our biggest hospices, now people are entering with huge comorbidities. They're entering later because they're staying at home. We're allowing them to stay at home and giving them facility to do that. But a lot of people, home is now residential aged care. And that's where they choose, hopefully, if they want to die in the facility. I'm desperately trying to work with residential aged care facilities to allow volunteers, our trained volunteers. It's mega training. They are specialised, but they're also, it's psychosocial, but it's with that understanding of what happens at end of life and what can happen for people, what things come up. I'm just concerned that I'd love to see like a first aid palliative care training be delivered to any volunteer that enters residential aged care because of the vulnerability of people and the particular needs, cultural needs. Anyway, I could go on forever as well, right? But I just want to know if that is being considered, particularly for something like CVS volunteers. I know that traditionally it's been as little training as possible. You know, it's companioning, but we are sending people into places to make relationships with people who are at end of life, last 24 months. That's how we class it. How can we protect the volunteers from vicarious trauma? How can we protect the clients that want to have someone with them at end of life because their family can't be there or their family suck?
That's one of the areas that emerged for us as a specialist type of volunteering in the area, and some of the facilities actually do specifically recruit volunteers to those types of roles. So it's probably got depends on which organisation and so on, but I agree that palliative care volunteering is a particular type of volunteering, and yet there are things that are part of the whole picture. Dementia care volunteering is the other one.
Well, thank you for that question, and it sounds like an incredible service that you do. Please sign up for our consultation. We've got the email there. We'd really like to hear from you because we do want to understand the training in the sector further and how that should be embedded and in what ways and what is important. What training is important, including for CVS. Yeah, and you're right. We do have this balancing act where we think there's training that we think is really fundamental to volunteers going into aged care. Like Megan is saying, dementia is really important. I think palliative care and understanding vicarious trauma and trying to protect them is really important as well. Understanding the ageing process, residents' rights. So there's, and also understanding how to deliver services, well, to be in a vicinity where you're going to have lots of diverse groups and make sure that you have some basic awareness of those groups. So, but we don't want to overdo the training, because we know with the re-engaging volunteers, too much training will put people off as well. But I think we do need to have foundational training for all volunteers, but how that should be embedded and what that should look like, we really want to talk to the sector about. So please sign up, and we'd love to hear more of your thoughts.
Thank you. Thanks.
We've got time for maybe one, possibly two questions. There's one down the front. Yeah.
Okay, mine's a fairly quick question. It's about the language that I've heard in this room that I find really interesting. The elderly people that you're talking about have been described as clients and consumers and residents, and I'm all about making volunteering easier. And I don't, honestly, and I'm sorry to say this, hear much language about how you're facilitating that person-to-person connection, and you're empowering these people to choose who they interact with in a volunteering capacity. Volunteers, I realise, have to go through processes to keep people safe. I understand that's the same in every setting, but I feel like there are a lot of barriers being put up, and I find that quite sad, to be honest. Sorry, I don't end on a negative note. I'm passing to Jasmine.
There's no need to apologise for that. I think it's really important that we've been talking a lot about formal volunteering, and one of the things that keeps coming up is informal volunteering, neighbourhood visiting, and I think we saw an emergence of neighbourhood volunteering and so on during COVID. What I've seen has been some friends coffee group type things emerging. They were not evident necessarily in the formal settings that we were doing research in, but I also think that the language and the focus is changing about being about the person, about the individual, and about choice. And I think even in the CVS program, the choice of what you want someone to come and do with you is part of the picture. I think you're right, we end up talking a language that is part of the way that we frame it. I was talking with a group of people at lunchtime about one of the ads we found when we were looking at what was being called for in terms of volunteers was for someone to come and sit with someone for half a day, once a week, to watch Benny Hill reruns on the video plan. So it is the case that some of these things are happening in that person level. I'm not sure that I could cope with Benny Hill reruns, but you can see that that's at the personal level. So the organisations are doing it at personal level. It's just some of the language that we're using, you're right, could probably be refined.
One more quick question, super quick.
Oh, okay. Very quickly, the CVS Great initiative. The first thing I saw on the page was that you are required to be over 18. The most underutilised demographic is under 18. And being from Kids Giving Back, we do have a program which pre-COVID we took a group of kids, it was called Connect for Good, into a nursing home with scones and, had conversations. I'm hearing that you've got volunteer managers at facilities. Potentially, I could be mistaken there, but could there not be a volunteer who has a Working with Children check, and in those volunteering opportunities you allow a few kids to go to, and that volunteer manager is the Working with Children check responsible person that oversees those kids? I've got Duke of Ed kids who would love to be able to go in to aged care facilities, and if there are facilities who will take kids in Sydney, please come and see me.
Thank you.
So, I mean, that sounds like a wonderful work that you do. I think CVS is a unique program in that it's facilitating a friendship and a conversation between people. So it's not activity based, or it doesn't have a curriculum behind it either. And we do have it as over 18 because of, you know, there are risks involved with having that very strong friendship, and we do need to look after, we do need a certain level of maturity because of the way that the program's delivered. But there are lots of other programs there that do focus on creating friendships with older people and the younger demographic as well. And I think it's really important. And those other episodes of the Older Person's Home for 4-year-olds showed us the value of that. So, you know, there is a lot of work being done, you know, through Playgroups Australia and that sort of thing to create those sort of programs which have more of a structure and a curriculum behind it. And I certainly know my kids, their school has created an individual link with the local residential aged care facility, and under the quality standards, facilities are required to ensure that you know, the social and emotional needs of their residents are being met, and that includes creating partnerships with local organisations in the local community.
Okay, now last quick question down the back.
Yeah, no, this is just very quickly based around the training. My name is Michelle. I run a CVS program in Perth, but also as one of the project coordinators on the re-engaging volunteers into aged care program in Perth also. And I think where the training comes into it, through the re-engaging, definitely our feedback was the training was overwhelming. But it was also very much a program that was a faceless program, in that we couldn't reach all of the volunteers that applied for it, just due to the vastness, one, of WA, as it was for all the other states. But also, while the numbers coming through weren't huge, for the amount of people on the project, it was very difficult from that point of view. From a CVS point of view, we find, and we often get from our volunteers, our training, excuse me, my voice is going, that our training can be a little bit overwhelming, but because it's done on a one-on-one person-centred approach to it, and we give our volunteers a 3-month period to get through their training as part of their induction into the program, we find the volunteers stay a lot longer, and if there's a particular part of it that they're not being able to do, or they can't engage online or whatever, we've got the time to do it with them, we get a far better outcome. So with CVS moving forward into the new format, I just really like to hope that there will be scope for that, and that the training, as mentioned before, does include vicarious trauma. What is palliative? Because at the end of the day, most of our volunteers are visiting people that are end of life, be it that they're at a palliative stage or just purely aged. And when you're getting volunteers, as Megan said, and I get emotional about this, but when you get volunteers not hearing that their clients passed away, or families choosing not to have a funeral because, you know, that's a bit of a waste of money, and things like that, volunteers suffer. And not all volunteer managers have the training given to them to cope with that. And EAP is wonderful, and all volunteers should have access to it, but often that volunteer wants the person that has brought them on board to look after them. So volunteer management training is just as important.
Thank you.
Yeah.
Thank you, everyone. I'd like you to thank our 2 presenters today. They've done a wonderful job of answering questions and delivering.